In this section, we'll show you how to measure your stoma. Measuring your stoma correctly is important because it helps reduce the risk of leaks, keeps the skin around your stoma healthy, and ensures that your stoma appliances fit properly. You should measure your stoma frequently at first, especially in the weeks following surgery, as its size and shape can change. Most stomas settle in a consistent size after about 4 to 6 weeks, but it's still a good idea to measure regularly, particularly if you notice leaks or sore skin. If your pouches are cut by your home delivery service, like Securicare, check your measurements each time you place an order. That way, your template can be updated if needed, and you'll always have the best possible fit. The goal is to cut your stoma pouch so it fits snugly around the base of your stoma, without touching it, leaving no gaps that might cause leaks. You'll need a few simple items: a stoma measuring guide, which you can get from your nurse or through a delivery service like Securicare. You'll also need a pen, a sharp pair of pouch cutting scissors, and a mirror if that helps you see more clearly. The measuring guide has different size openings. Place it gently over your stoma and find the hole that fits best. If the guide touches your stoma, the hole is too small. If you can see skin inside the hole around the stoma, the hole is too big. You're looking for the opening that fits comfortably around your stoma without touching it, ideally leaving about 1 millimetre of skin visible all the way round. Write down the measurement so you know if it's changed and you need to update anything. Some people have stomas that aren't perfectly round. They may be more oval. If that's the case, measure the widest and narrowest parts using the template. Apply the same 1 millimetre margin rule around the stoma and make a note of both measurements. This will help you cut your appliance to match your unique shape. Sometimes your stoma care nurse might provide you with your unique stoma template, pre-cut on the stoma pouch release liner, or even on a piece of cardboard. You can use this in the same way to check your template regularly. If you can see skin showing and the stoma has got smaller, then remeasure your stoma. The same applies if the template feels tight in an area. Here are some tips from stoma care nurses. Measure your stoma when you're calm and not rushed, like after a shower. Make sure the area is clean and dry. Use natural light if possible to see clearly. If you're ever unsure, don't hesitate to ask your stoma nurse for help. Once you've measured your stoma, you'll need to cut your pouch to fit. You can choose to do this yourself or have it done by your home delivery service. For example, Securicare offers an ultrasonic cutting service that provides an accurate professional cut. There are also pre-cut pouches available in common sizes, which may suit some people with round stomas. But for most people, especially if your stoma is oval or irregular in shape, a cut-to-fit pouch offers better precision and more secure fit. To cut your pouch at home, you'll need pouch cutting scissors. These are especially designed to cut cleanly and accurately. You can get them from your stoma care nurse or request them from your home delivery company. For round stomas, take your measuring template and place it over the release liner of your pouch. Use the correct size opening and draw a circle using a permanent marker. This will be your guide for cutting. If your stoma is more oval or irregular in shape, you'll need to mark both the widest and narrowest dimensions. Use the measuring guide to mark each size on the release liner, making sure your orientation is correct. Then join the lines together to create the right shape. This helps you to get a snug, personalised fit. Use your cutting scissors to pierce the centre of the marked area and then cut outwards to the line. Carefully follow the shape you've drawn, taking your time to make sure it's smooth and accurate. Be careful not to cut through the bag material. Once you've finished cutting, run your fingers gently around the edge to smooth out any rough parts. This helps prevent irritation to your skin. Here are some tips for cutting your pouch. Use a clean, flat surface and good lighting. Permanent markers make clearer lines that won't smudge. Always double check your measurements before cutting. If you're not confident, ask your stoma nurse for support or consider using a cutting service.